wonderful mentor. Oh gosh, pressure. You always a wonderful mentor, and kept my career afloat as I've been gone this year. And I specifically chose that photo for you, David, my favorite Irish Canadian. She's wearing her Shamrock Vikings. Okay, so let's get to some content. Anna, in her talk, we're kind of coming full circle. She went through the goals of the Data Champions program. So we basically saw this need for training specific and mentoring specific to the biomedical sphere. So there are resources out there, of course, about data management and data sharing, but we felt there was a gap in this space, and the quality of resources more broadly perhaps wouldn't take someone into the field to actually get things done. They're a little bit too high level. We also envisioned this data champion cohort. So we were fortunate to have a speaker from Cambridge. So we've been sort of sleuthing on the Cambridge website for years about their data champions program, really wanting to emulate that here. And this funding allowed us to get that started. We wanted to build resources alongside patient partners because working in biomedicine and any research really that's publicly funded, we think that just makes sense. I wanted to highlight Maxime's wonderful talk in that respect this morning. I've actually been working and connected with Maxime for 5 years, but never met in person. So it's great to connect today. And then finally, as has been mentioned, we had this commitment to evaluation to ensure that, what we're doing, we want to make sure that it doesn't just make us feel good and make sense to us. It actually, when we implement what we're doing, it actually achieves the goals of transparency, robustness, and so on. So that was really important to us. And then finally, this sort of national scalability. So that's going to be my focus today. So I'm going to try to take us from where we are, what we've done, to sort of what we ought to do in the future. What should we request funding for, and how should we sort of structure our research programs to best support you guys and other members of the biomedical community. Okay, so we've been talking about this all day. Why do we care about data management? You've obviously registered for this session for some reason. Hopefully it's not just the credits that you receive, but even if it is, we've got you in the room somehow. And for me, I think a lot of researchers, there's an intrinsic motivation. We want to do good science. We want to do excellent science. And part of that is good record keeping. It's sharing our data to promote innovation and sort of meeting these best practices that we sort of aspire to as researchers, but also that are coming down from agencies. It can support transparency and reuse. So just very practically, I know that when I started implementing better data management and sharing practices, it's super convenient. I can go find my old data because I'm sharing it publicly in a way that was much, much better prepared than if it had just been in a folder on my laptop. And then finally, it honors our responsibility to patients and the public. Doug spoke about how, a lot of the work that we're doing is taxpayer funded and, millions of dollars being spent. And Maxime has highlighted this personal example of how this money has never actually come back to them in a meaningful way with outcomes and results that they can read, assess, and implement in their own lives. So for me, when I talk about, why I care about data management and, how I have a career focused on helping people implement better research practices, when I talk to patients, public members of my family about the efforts we're undertaking with, say, our Data Champions program, they get very confused. My aunt, who's actually an MD, actually said, "Aren't you a bit bored doing that?" And the reason is they assume it's already happened. They assume that the status quo of research is transparency, rigorous record keeping, data sharing, and so on. So unfortunately, we all know that that's not the case. But I think, the patients and public, when we really engage with them, they assume it's occurring and they find out it's not. They're not very happy about that. Okay, so, we're all here. We all strive for this moral imperative. But let's imagine I emailed you requesting data from a paper you published in 2020. Who here online or in the room, when you think to yourself, would you be able to track that data down quickly? If so, would you be able to understand it and quickly make sense of how you've stored your data? And finally, would you be able to actually share it to me immediately in a meaningful form? Most of us, probably not, right? We're not holding ourselves to standards in our day-to-day practice, which are basic things like archiving, creating a code book, storing our data in a way that makes sense and a way that is shareable in an interoperable format for others to use in a meaningful way. And, taking it back to the patients, which we sometimes, I think, forget that's why we're all here, right? We're all here. We went into research, not for nature and science publications, but to, you know, better healthcare, make discoveries, improve the lives of the patient and public population. So we ought to be doing these things, and we're not. And I'm going to come back to sort of why I think it is that we're not. Another example, no one plans to spill coffee on their laptop, but let's imagine today in the conference this happened to you. Would there be active files saved to your desktop that you're working on that you would lose forever? Data sets, presentations, things like this. So basic to store to the cloud, but many of us aren't doing it. Why? Why is that? We are all here committed to this, but you know, these types of things happen all the time, and it may result in permanent loss of data. In my capacity consulting at various institutions across Ottawa, I've had so many like comical interactions with researchers, very prestigious researchers that, you know, also have those science and nature publications, have come to me with questions like, you know, oh, we have this data for a study, but we lost it, but we have the summary tables. Do you think this will be a problem? Like, yes, I do think it will be a problem that you have no data. You don't have data, you lost it, that's what you've just said. So this happens all the time, and it happens in groups that are very productive and proliferative. So I think it's probably more likely the norm. And for those in the room who are graduate students or trainees in some capacity, I sometimes talk to PIs and they assure me, you know, everything in their lab, they have robust procedures in place, they're storing things, they use the cloud, they've got a folder for each of their students and so on. But then when I ask students, do your PIs have control of your data, and do they manage you according to any standard operating procedure? The answer is no. So students tell me that they make things up as they go. No one's ever taught them specifically how to manage their data, how to even organize their data. Forget like where you're saving it and whether you're archiving it, just like how to actually input the data. It's something they make up on the go. They learn from the postdoc in the lab who's friendly. And so soon, after I talk about extrinsic factors, I'm going to address why I think these good intentions fail in these situations. Okay, so in terms of external motivators, we've seen through several presentations today this new tri-agency data management policy and the different components of it. So there's these three components. We don't have to use Chatham House rules, Doug, because I publicly insult the tri-agencies often. So there's these three components. So there's this institutional strategy, data management plans, and then deposits that are coming. So you can see that there's three things in that order, but actually the first component in terms of data implementation is actually data management plans. So before we have any supports or policies or institutional strategies, they started rolling out the actual mandate for DMPs. So this sort of general policy, which we've heard about from other speakers, looking to get the tri-agencies to be more transparent and rigorous about data management and sharing, it mirrors a lot of other international institutions, funders, and so on, in terms of wanting to meet those goals. I'd say it's actually more gentle. Like we're behind, even though we're implementing it and it seems forceful in our local context. I think in the international, certainly the European, American context, we're already behind. I wanted to highlight, so I put some examples on the previous screen of institutions and organizations that have data sharing mandates or policies specific to this, but I wanted to highlight this tool in the talk because you can actually look up funders and see what exactly their policies are and the special conditions. So for instance, some grants in certain organizations, they're only requiring data sharing because this makes total sense to patients and partners for funding above a certain amount. So it's like patients only care if the grant was over $500,000 to have that data shared. But at least that's the policy, and then you'd know it if you look it up on this website. Okay, so the first part of the tri-agency strategies was the tri-agency's data sharing policy strategy, I should say, was to have these institutional strategies. So that was by March 1st of this year. Check out their website. We have N equals 14 institutional policies for our country that have met that deadline. So these vary considerably in their quality, I would say, just from my tertiary glance. Some are short as 3 pages. So an institutional strategy helping to implement these policies, 3 pages long. So you can see that I think already we're falling short. There's nothing done here in terms of screening, in terms of quality assessment, in terms of evaluation or ongoing monitoring. So these institutions have ticked the box in creating an institutional strategy. Whether they implement it or how effective they are at that, we don't know, and I don't think we will know. I mentioned that the second component, which was the first component introduced, was the actual creation of DMPs. So here's just one example of competition for each of the funding agencies where the DMP mandate has come about. But what's really interesting about the process, so I'm just telling you what's happened. I'm not saying I understand it. What they've done is basically they've created a requirement. So these competitions as examples, folks have to have DMPs at the initial grant submission phase, but we don't really know what's going on because they have explicitly said that the DMPs will not be evaluated as part of the funding decision. So I don't know about you, but if I'm ever told that there's a component of my grant that I need to do, but no one will consider it as part of my application, I don't know how much effort I would put into that person. And I can imagine, I don't know if they're going to look at the DMPs that they receive in some way and then inform future decisions. But I can imagine even if they choose to do that, they probably won't be very meaningful. Let's imagine not everyone is as terrible as me and others put like great effort into these DMPs that aren't evaluated. The second component is that there's actually been no training for the reviewers on the committees. So they're to read them, and I'm not sure, just for personal interest sake, they've then read the DMPs. They're not to evaluate them. The peer reviewers are not told specifically how to use the DMPs. So you can see that this is quite frustrating and will ultimately, in my view, lead to failed implementation if we don't make changes. Just another external motivator, some really care about journals, just to share that journals also have data sharing mandates. Sometimes it's just a data sharing statement, but increasingly journals like PLOS, Publishing Group, they're moving to like firm mandates. And it used to be that you could say something like, oh, I don't have ethics permission to share this data. But I think increasingly the journals from PLOS, for example, they're not going to want to see that. You know, we're now in 2023. You know that you need to ask for consent for sharing from your data. So that's not an acceptable excuse at this point. And I think that they're coming down more strictly. The BMJ has sort of tiers depending on the journal you're at in terms of how strict they are with data sharing at this time. So the point of sort of presenting this, some of what you've heard today, is to sort of get a synopsis of sort of where we are in the Canadian landscape. I think we probably have a community of researchers that would like to be sure to meet data management and sharing best practices. We have a funder that wants to do it, perhaps isn't going about it in the right way, but there's this gap basically between sort of what we as individual researchers or we as a tri-agency organization want and what probably we'll get. So I want to talk about that gap and then brainstorm with you guys about sort of how we as a research program in the Ottawa area, but then nationally scaled as a data champions program, might actually provide resources and actually address this. So in my own view, our program sought to address this by considering sort of two things: the technical barriers to data management and planning, but then more specifically, the non-technical barriers. And I think, Doug, this is exactly what you were saying. It's the non-technical barriers, the behavior change that is really core to actually implementing this. So technical barriers, for instance, navigating the DMP Assistant, which is a tool in Canada to help with creating data management plans. Those exist, but I think they're a lot easier to overcome than some of the non-technical barriers, many of which Doug mentioned. I think for me, as a researcher and as someone sort of working on this program, there are some core bits of understanding or training that I would like to see all researchers have. Certainly, there's discipline-specific training that we need, but I would say these things are all core. So what is research data? So we've talked about how it's not just Excel files. There's lots of different components. What are the FAIR principles? And not just like what FA and I and R stand for, actually what it means. So to make your data interoperable, to make your data reusable. So like the actual mechanisms to adhere to the FAIR principles. The OCAP principles, same thing. Whether you're working with Indigenous populations or not, I think that's important to know. And I agree entirely with what Doug said. a lot of those principles, I think, apply more broadly to the community. So they're sort of best practices. Relevant funder mandates. So we've talked about the tri-agencies, but people get funding from all kinds of different organizations. Not-for-profits, for example, are also having mandates in this space that we need to be aware of. What is a DMP? So Jody spoke about this from observational research perspective in the morning. I think most people know what a DMP is, but how to actually create one and the different steps and the tools and resources, I think are really key for everyone to know. How to organize your data. I have a slide coming up that will speak about that a little bit briefly. Very basic things like organizing your data are skills that we've learned on the job. So they're not necessarily things that people are even aware they're doing incorrectly. One example that I certainly was guilty of was like color coding in my data set to sort of make it stand out to folks when I was sharing things, what they were looking at. Big no-no, and better ways to do that. How do you actually share your data? So again, this is a more technical and practical thing, but it's one people just have no idea. They don't even know where to begin, where to put their data, or in the case of some clinical work, where not to put your data. And in that sense, broader privacy considerations too. So these are just 8 questions that I think that our program has helped to address through the educational seminars that Anna and David put on, but also through the website of resources. So you can check that out if you haven't already to get these supports if they're relevant to you. This is an infographic we made a couple of years ago, just in terms of how to store data in Excel spreadsheets. Which is one way many people share data. So I'm not going to go through the sort of do's and don'ts specifically, but just to stress again, these are things that no one teaches you. It's something that you see other people's data sets and you kind of make up a data set that looks a little bit like that one. And then if someone complains about something, you make a little bit of change, and maybe then you adopt that change into your practice. I know certainly when I joined New Labs as a trainee, there was no like, welcome to the lab, and this is how we do our data management and storage. So I think that we should aspire for more. And there are very specific things that you can learn and skills you can take and implement. And what I would suggest is sort of biting off things one by one, because I'd like everyone to have a revolution in data management and data sharing, but probably not realistic. So that's another example of the types of resources that this program has produced, but also that I think I'd like to see them continue producing in the coming years. So yeah, the vision here is to create supports that make sense for the biomedical community as well. So a lot of what I've talked about so far maybe also might apply to, say, people seeking NSERC funding, but we want to specify some of our resources really to our community. And so it's this idea that, are you sure this is how we get data into the cloud? I feel like most of what data management and planning and sharing is in biomedicine, at least where we sit, is just people like trying their best, but not really knowing what to do. And what a sad state of chaos that is, right? So we have the intrinsic motivation. Now we're getting an extrinsic push from our funders. So I think with the right behavioral science, we can do the necessary community changes to actually do this in a more systematic way. Just as an example, so this is from the DMP Assistant, which is a great tool in principle. They have templates for DMPs. Anna's mentioned we have created 3 that we hope to have published on the DMP. I think we will have published in the DMP Assistant for folks to use. If you look on this list of different examples, like one of them is for an open science workflow. Like what even is that? Like I'm a meta researcher. I can't imagine ever needing a open science workflow template. Like, is that not all science? Like, are we not trying to do that for all of our research? So I think that, we need really, the idea for this is great. The platform is much more user-friendly than it has been in the past. So there's been really positive things that have happened, but we need that sort of disciplinary lens to make these really more usable and make sure that, what we do here is the same as what we do for grants, which is the same as what we do for submitting to journals. So there's some consistency and limited administrative burden. Okay, I'm going to end my rant and hopefully now have a bit of discussion with you guys to get sort of your views from the day, your views from my talk, and views from like a broader perspective in terms of where you think data management and planning needs to go within Canada. So I wanted to do an exercise using French's implementation steps. So there's 4 steps basically to this behavior change model, and it helps people to understand how to go about implementing change for a particular problem. So step 1 is who needs to do what differently. Step 2 is what are the barriers enablers to implementation exist. Step 3, which strategies can be effectively used to target those factors. And step 4, how can we robustly measure the effects? So monitoring the change and know that we've been effective. So I have 4 slides left. Each is a step from the French model. And I want to open it up also to folks online. I think this is now open for people. Is that correct, Anna? Yeah. So people can now type and see others' comments, I was told. More interactive. Excellent. So I wanted to open it up. And in answering this first question, so who needs to do what differently to make RDM right in biomedicine? So what do we need to do as a community? And we can think of this from a variety of stakeholder perspectives. So there's patient perspectives, there's administrator, institutional perspectives, governance or funding bodies, and so on, researcher perspectives. So I'm going to stand here awkwardly until someone says something. So who needs to do what differently? Maybe we want to pick a stakeholder and start some discussion in that respect. Maxime, thank you.
This is like a blue sky thinking. It probably doesn't. Thank you. This is a blue sky thinking. It probably doesn't answer the appropriate steps. I had an idea throughout the day of like, what if apart from the data champions program that's going to be run, eventually the end goal is to have like a certified data management professional, like a certification. They can, your CV, LinkedIn, whatnot shows researchers, academic institutions that we know how to do correctly a data management plan, and all those considerations. Maybe that could be real ones.
I love that idea. So if folks didn't hear online, it's the idea that we'd have almost like a core accreditation to say that you have basic skills in data management, planning, sharing, and so on. And yeah, I think it's a really great idea. There's so many things like I take every year that are required of me for my institution or funders or different people that, like for instance, like WHMIS, like David and I have talked about this, like I don't handle a lot of hazardous chemicals in the metascience lab. I have to take this every year, identifying various combustibles and so on. Not particularly pertinent to what I do, but it's something that my employer makes me do. And maybe employers of research institutes want to have some basic core training for people doing data management, which is pretty much all of us. I think that's great. Any other thoughts on Maxime's suggestion or other thoughts for maybe at the institutional level, since that's sort of what we're talking about, of who needs to do what differently? So I'm hearing from Maxime, like institutions need to provide training for researchers. Other thoughts?
Yeah. Well, I think the key behavior change is the data custodian. And I think like the institutions support the data custodian or create, punitive or whatever, but I think it's the research teams whose behavior needs to change, and it's how do we effectively do that?
Yeah, so the people on the ground, right? So, which is why for me, the tri-agencies, they developed this data management sharing policy, I don't think with a great deal of consultation. And I think that's really problematic because it's easy to say like, oh, start doing these things. But, if the people on the ground don't know how, they don't have the technology, they don't have not yet learned the technology, they don't have the incentives, it's a behavior change issue. Yes.
Yeah, I think your comments about the consultation is important. Just from the geo research institute perspective, we hear like, oh, you're gonna have to put your data somewhere, right? I as a decision maker, do I have to go out and procure something? Do I have to go make a deal with Microsoft to store all my data somewhere that's accessible? Will this data repository be provided for me? These are the things that we need to make decisions about because there's not enough clarity back and forth about that. My other thought is around projects. So what Lily was talking about, where we do a machine learning thing on 100,000 patient notes, and we're trying, various techniques. I can't just take 100,000 patient notes and just put them on for free and open access. So how do we deal with those scenarios in particular?
Yeah, really great points. They definitely resonate with my experiences as well. Like working in consulting, I know from my perspective, a lot of researchers or team leads would come to me and just be like, okay, what do I do? They just like, they know they have to share their data because they got NIH funding. Tell me where to put it and how to do it to be like minimally required to meet those standards. So, you know, it's almost like what Maxime mentioned about sort of the learning. It was almost like in my experience, the desire to learn isn't really there because the pressures and time restraints and incentives are so limited. They just want to get like things done to the basic standard without having to think about it. So, you know, if a trusting person says, "Oh, just put it here," they do that without a lot of thought because it's so overwhelming if you don't have those expertise. Yeah. Oh, for sure. Do you want to read it up? How do you feel confident enough to share data with others, especially if there is potential they misinterpret the data? Yeah, so it's a great question. So the first thing I always like to say when I'm asked this question is that the idea that we're sharing our data, although there's new policies, that's not a new concept. So we've actually always been required to, if someone has asked us for data, to make that data publicly available for many journals, for many types of data, not all, of course. So the idea is here that it's just available immediately and openly to everyone, so it's equitably available. I think that what I would say to that in terms of the fear, you know, science is a correcting process, and I would like to think that, you know, if I did something wrong and someone pointed that out in my data, that, you know, I could take the necessary steps to correct that, and that would be a good thing, right, for the scientific process. So it wouldn't be a good thing for me as an individual, perhaps, especially as an early career researcher. But I think that more and more cultures are changing and people are being aware. Like, for instance, when someone makes a correction to a paper, I think this used to be like, you know, very scary, terrible thing that happened. And now I think it's becoming a lot more normative. So what I would encourage people to do is, you know, get training on how to share data if there's that at their institution, work with people who have done it, maybe get input or support from others if you're just starting out doing this. But also, you know, if you're starting out initially, you can share just summary data, right? You can start at a low hanging fruit, so to speak. Don't share every single piece of your project, right? So we share in our group like surveys, materials, our ethics form saying it was submitted, like everything like this. Maybe don't start there. Start with the basics and work your way up.
Building on your previous point about tell me what I need to do, let me suggest it's not just that I need to do it, putting one more thing on my shoulders, but rather as a research institution, provide the resources and supports to enable me to do that, so that I don't have to create my own infrastructure to put my data up openly. I don't, and perhaps have an individual to whom you can hand off and make it deal with logistics. So I don't have to do it.
Yeah.
I can be compliant with that, but help me to do that.
Yeah. You can start running the administrative research offices anywhere I'm affiliated with, because I think that's so true. I think in some ways we're going to always need researchers involved in the data management process and certainly sharing process to get their content expertise. But I do think that, you know, it's probably not the best way to spend, let's say, like a cancer biologist's time, like ruminating over their data to put like in the right format. Like they need to be involved, but perhaps not the one physically necessarily doing every step. So I think, yeah, what you're saying makes sense, and what it requires, which maybe we can talk about. So that's who needs to do what, but what barriers, enablers there are. I think what it requires is funding and support. So for instance, today we were really fortunate, Felicity Taylor was here, who's the University of Ottawa's librarian in the sort of data section. And she's wonderful, but I mean, she's one person, right? And, you know, her background is in an arts area, which is great for those in the arts community in our institution, but it's not reasonable for an institution to invest so little and to get the resource so broadly and so specifically. Like I know for myself, working in biomedicine, like I would have no idea how to manage like proteomics data. It's not reasonable from my experiences to know what to do with that, right? So I think we definitely need those expertise, but scaled up a lot more than what is typical in the Canadian setting. Okay, I only have a few minutes, so I want to get a little bit more discussion about barriers or enablers to implementation. So we've talked about some of the actors that are part of this ecosystem of data management and planning and sharing, and some of the barriers we heard from Doug. An enabler I mentioned was funding. Are there other thoughts on barriers or enablers? So when you're sitting there thinking like, you know, I could do this, but what is holding you back, or what would help you get over the hump?
My name is Simon Career. This is sorry about that. I'm research politician specific for IBH. Mine is just to researchers to say that's also because one of the things you say is to go back to the basics, if I understand it correct. And part of the basis is good documentation practice. I would suggest that researchers should also take time to read through the World Health Organization policy of good documentation of data management practice. That will really help us in knowing how to document these data that really refined in such that whatever result is coming up from them can be relied upon. So it's just a suggestion.
That's right. And great suggestion. So it's the World Health Documentation Policy. Okay, so that's something folks could look at for sort of best practice standards. Other barriers or enablers? He's going to go on a rant.
I won't. I'll be well behaved. So I think it would be really nice that if organizations like the U15 stood up and said that open science is something really important for society. And we think that institutions that are members of the U15 should enable this. On top of that, it would be very nice for the Vice President of Research at universities to get up and sort of say, we support this, we endorse open science, we think it's a way forward. The Canadian government is supposedly an open government, and we know that open science is a way of advocating for sharing knowledge quickly, et cetera, et cetera.
That's great. I have the sense a lot of leadership is afraid of open science, and it's kind of in a bit the same way researchers maybe are not implementing it because they're just not aware, they're not educated fully on sort of what it is. Many of them equated, open science is open access is expensive. And that's sort of the end of the discussion. So I think we need to educate and then get them to stand up because I think they, when educated, understanding for it.
From a research perspective, I think there's a lack of reciprocity. Like I think you don't gain very much by sharing your data. And so there's no rewards for the effort. You're not like, and I'm talking beyond sort of acknowledgement. I'm talking like, if you do it, you're going to be doing less research papers, like kind of like what we're trying to do. What I tried it, and I think some of this, there's various reasons for that, but what I try to say for a master's student, by the time you finish, I think you're going to finish at the same time, but it's going to start off a lot slower. But if you do it right, your job's going to be easier. If you have your dictionary at the beginning, like I said, then you screw up less often in the middle of the end. But it takes you time to get going. And if we can make it so it makes that kind of like that immovable objects easier to do, like publish papers for students, then I don't think we're going to change it so that a PhD student can just publish one paper, but it's going to be really good. Or really open. They're still going to do 3 papers, but we need to be able to do those 3 papers quickly, fast, open science, data sharing. And if we can achieve that, then we'll.
Yeah, great points. Although I was slightly disheartened, I would like, there's no minimum number of papers for anyone ever. But yeah, the system that we're in, prizes itself on papers, and there's this whole discussion of incentives and rewards alongside open science or data management and sharing as well. And I think that right now, for instance, at any stage, there's no evaluation of those processes. I think that the incentive or what might enable people, as you say, is maybe you're more likely to get published, maybe make things easier on yourself as you go along the project. But no one right now looks at the grad student on assessment day when they're defending and says, like, you know, did you manage your data robustly? Did you share your data? I would say though, like in terms of like what can be valuable, I again think it's a mind shift that we need to have, because for instance, you know, having others cite my work or aggregate it in a systematic review, my data, these are, I think, really responsible things and things that we could be happy for as researchers. And why we're not is because, you know, I'm not going to get a promotion because people are using my data. I'm not going to get hired or, you know, pass my PhD defense. So, okay, I'm going to move on to the next one. And yeah.
I don't want to sound like I'm arguing against what's been said here, but you know, Doug was talking about the benefit or lack thereof, but there's also the element of risk. So you spoke about witness, but the other training we do is PHI. And I think that that's something that we need to balance not only for ourselves, but for the trainings as well. So we're told, be very careful with patient data so we don't identify. And now we're talking about open access, which is the other. I understand that there's anonymization that has to happen along the way. That's easier said than done with some data than with others. So I work in the medical imaging world, and it scares me that if I send out a CT, you play with it a little bit, and all of a sudden you get something that looks like a face. Scares me that in the big data world, it seems like it's anonymized data, but once you look at how many visits they have in a hospital, and you can start to narrow it down to an individual. And so it's not that I'm against anything that's been said here, but there's really a need for education. Myself as a researcher, like actually all this emphasis on open data, this is new to me. I haven't heard this before, and I haven't been living under a rock. I'm actually one of the people that's here. There's countless researchers that are not here, and I think there may not be privy to this type of conversation. When we apply for the grants is when we hear about it for the first time. And if it's going to be the same way as it was for like inclusion diversity, it's going to be awful because we're all going to have to make this up on our own. Yeah. And so really guidance, please. These
are great points, and I think it touches a little bit on the person from online, you know, the fear of sharing. I definitely think what you're saying about sort of discipline specific input is really important, right? So there's lots of people that work with clinical data that's much easier to make anonymous and so on, and others less so. And we need to appreciate that some people's data will never be openly available. And I think that's fine, but coming up with the bounds of you know, nothing being available and sharing what we can, I think is important. And for instance, like in Maxime's story as a patient, like never knowing the results, like summary data can be made available in places that patients may access or we could communicate to them. So I think step one is managing data. Generally, we're not doing a good job at that. And then step two is looking at sort of how we might communicate and share the data more publicly for researchers and patients and the public. Okay, we don't have a lot of time, do we? We're cutting in. I don't want to go over. We're at time. Okay, I think what I'll do is I'll just stop there then. I think we've had a good discussion, lots of input from different folks. Certainly, I know I will be very keen in 1 month when I return from mat leave to engage with folks if they have other ideas, if they want to, you know, become a data champion, as Anna mentioned, or expand this program. I think our website will be sort of a landing ground for what we're doing. So I'd encourage you, if you're interested, to continue to stay up to date on that, and any resources that we produce, of course, will be openly available. So I'll stop there. Before I do, I wanted to just thank the broader team. So of course, Anna and David were really the ones lugging most of the weight here, but there's a really great team, many of whom you've heard from today, either online or in person, that I just wanted to acknowledge and really appreciate them as well as I've been off. And then just I'll stop there. And I don't know, David or Anna, if you want to have some closing words before we head out.
Thank you, Kelly, very much. So this has been a really great day, and we've had good participation of participants online, and We've had an eager group here in person. Thank you all for the wonderful presentations. I think we've got a long way to go, but we're all together so we can conquer the world more easily. Thank you for giving us your time today. People are busy, so really appreciate all the time, and have a good evening. And that's all for us. And we'll make everything available online. Sorry?